This is for all the PTs out there. Hi, I'm Dr. Caleb Slater. I'm an expert orthopedic physical therapist with 17 years experience and multiple certifications, including McKenzie Physical Therapy, which is my favorite. However, there's a few limitations in this approach that once I changed, I saw significant improvements in my patients and their outcomes. And one of them is something that you probably won't believe. It's taking this step a little bit further. So when McKenzie first started, he was primarily treating the spine, and then he realized that a lot of the peripheral symptoms like shoulder pain, elbow pain, hip pain, knee pain, foot pain were actually coming from the spine or had a spinal origin component to it. And this is where the peripheral approach has evolved within McKenzie. But there's even further to go because a lot of the symptoms out there that patients are going through that are poorly defined, such as dizziness or nausea or acid reflux or headaches or asthma, breathing issues, heart rate issues, blood pressure issues, and even GI issues, actually have a spinal component to them. And when I took this process just a bit further, the same mindset that was already established, the same thought processes, and just applied it to these patients and thought, hey, where in their spine could be causing these issues? Then evaluate that area of the spine, possibly treat it, and then see if it changes the patient's symptoms. And once I did this, I was amazed at the outcomes, truly amazed, to the point where it took me a while to even believe what was going on. But after years of doing this and seeing it work over and over and over again with different patients, with different symptoms, with different diagnoses, all of which that have been treated multiple times through multiple providers throughout the medical system and not worked, but just applying this approach and seeing the outcomes, that's why I'm here, because it's a better approach than I have found. That's why I wrote my book. That's why I'm doing my podcast. That's why I'm on this TikTok channel, is that I see a better way of classifying, diagnosing, and even treating and explaining a lot of symptoms and conditions out there that are really poorly explained, poorly treated in the medical system. So don't just limit yourself to orthopedic symptoms. Start listening to your patient's other symptoms. Start seeing if they're changing, if you're working on their spine. And let's just take one for an example. A lot of my patients that were diagnosed with ulcerative colitis or Crohn's have a problem at their TL junction. This area innervates the intestines. And remember, if the nerve signal isn't getting there, your intestines, the muscles, smooth muscles, aren't going to work properly. That less contraction, less blood flow moving, less nutrient exchange, less moving of waste will lead to all the same symptoms that will lead a patient to getting diagnosed with Crohn's, ulcerative colitis, or IBS. So, like I said, don't just think orthopedically. Think your patient globally as a whole and see if you're getting changes, and now start to think, hey, where in the spine could have caused that? And you will be surprised on what you can treat.